Okay, can you see my slides? Can you
Yes,
hear me?
everything is fine, Vicky.
Okay, terrific. So I apologize. I had a hard time getting on and then I was double muted. So I apologize for the delay here. But it's very nice to be with you here this morning, your afternoon, your time. I'm Vicky Whittemore from the National Institutes of Health. I'm a program director in the National Institute of Neurological Diseases and Stroke, where I oversee grants on epilepsy as well as on ME/CFS and now long COVID. And in addition to that, I work very closely with Dr. Korashep, who's the director of our institute, to both coordinate all of the ME/CFS research across NIH that's supported by many different institutes at the National Institutes of Health, as well as to help coordinate an interagency working group that coordinates activities associated with ME/CFS across all of the federal agencies in the United States. So you've heard a lot about the overlap and comparisons between ME/CFS and what we call PASC, or post-acute sequelae of COVID SARS-CoV-2, which is very long to say, so I'll just refer to it as long COVID. And what we do have recognized now, as has been pointed out, is that there is phenotypic and mechanistic overlap between ME/CFS and long COVID. Both seem to have dysregulation of the innate immune responses. And there is the possibility that there's viral persistence or viral protein-mediated immune responses in both ME/CFS and individuals with long COVID that need to be explored and are being explored in research studies here in the United States and likely elsewhere, and that clinical trials for early intervention that modulate the immune system are needed. So one of the difficulties, and this is really comparing ME/CFS, research on ME/CFS and long COVID, one of the problems we've had all along in studying ME/CFS is that there likely are multiple etiologies. So if it is a post-infectious syndrome or disease, then there are likely multiple infectious agents that could lead to the same symptoms that we call ME/CFS. The advantage of studying this and the pathobiology in long COVID is that it's a single etiology. We know these individuals had SARS-CoV-2 or COVID infection and now are developing persistent symptoms, which we call long COVID. So as I said, it's not clear which pathogen to look for in ME/CFS. The subacute phase is really hard and challenging to study because many patients aren't diagnosed for months or sometimes even years after they first showing symptoms, whereas we can really study the conversion from an acute infection of COVID to a long COVID status or the more chronic phase of the disease in individuals with long COVID. One problem with studying individuals with ME/CFS, especially those who have been ill and especially those who have been house and especially bedbound, is that deconditioning, or the fact that they have been bedbound for so long, becomes a confounding factor. And a problem that we've had in studying ME/CFS is that the pathophysiology studies sometimes are not reproducible because of very small numbers of people who have been studied, or because of the heterogeneity of the individuals who have been studied. So some may have been sick for a year, some for 30 years, and some with very different symptoms, some likely with different causes. So that becomes very challenging. And we're hoping that clinical trials in long COVID will help shed light on what clinical trials could be successful for ME/CFS, and those may be able to be done in smaller groups of people. So you've heard about this, that recovery from SARS-CoV-2 is really unlikely after you've had 3 to 6 months of persistent symptoms. And here I'm talking about, as was mentioned earlier, individuals who had a more mild case of long COVID, not those who were hospitalized and on ventilators who had very severe disease, because that does lead to very different sequelae following that hospitalization. And I'll come back to the research that's going on long COVID toward the end. So in the United States, there is a U.S. MECFS clinician coalition that came together to develop some clinical management guidelines for treatment of individuals with MECFS. So I have the website here. It's mecfscliniciancoalition.org. And you can go to that website, and there's really excellent information there about clinical management, including diagnosis and management, diagnosing key comorbidities, special considerations, assessing disability and accommodations for individuals, and there's other resources and medical education there. And one thing that they also provide is if you go to the About Us button on that website and scroll all the way down, you can actually send the coalition questions about specific cases, about any questions you have about MECFS, and one of the individuals who are part of this clinician coalition will respond to your question or your request for information. And this is really, the information is really geared not for MECFS specialists, but for other individuals in the community who see individuals with MECFS who really don't have that extensive experience in seeing and diagnosing and caring for individuals with MECFS. In addition, there's a lot of information both for medical providers, healthcare providers, as well as for individuals with MECFS on the Center for Disease Control and Prevention website. And again, I have the web address here. It's cdc.gov/ME-CFS. And you can go there. There's excellent information. Again, a lot of videos, a lot of medical information is provided on that website. So we're not without challenges here in the United States regarding diagnosis and clinical care for individuals with MECFS. So it is still very challenging to get a diagnosis for MECFS in the United States because there's a very limited number of healthcare providers who are really specialized and knowledgeable about MECFS. And stigma has still continued to play a role in that in terms of physicians not believing that it's a true disease. There are many individuals with MECFS who need multidisciplinary care, so they may need to see a neurologist, an immunologist, and with the healthcare system in the United States, those individuals typically are not located in one place in a multidisciplinary clinic. And we have the challenge of our insurance system, where the insurance often will not cover seeing all of those different specialists, or the healthcare providers actually don't accept private insurance, and so patients end up having to pay out of pocket. So the attitudes, it's interesting, the attitudes and perceptions of MECFS have, however, definitely shifted now that so many individuals who had SARS-CoV-2 have long COVID. So people are now realizing that there is this post-viral, post-infectious symptoms that continue into a chronic phase, not just for those with MECFS, but also for individuals with long COVID and likely other infectious agents. So many in the United States right now, in response to treating all these individuals with long COVID, there are now many across the country long COVID clinics that have been formed, but now the problem is they do not provide care for individuals who were previously diagnosed with MECFS, but we're beginning to see a shift in that also now that there are actually, with vaccination and hopefully less severe cases of COVID, there are fewer people being diagnosed with long COVID. So in the United States, research on MECFS is currently supported primarily by the National Institutes of Health, where we're supporting more than $15 million in research on MECFS at the moment. And these are grants either that are submitted by individual investigators We also have a network of collaborative research centers and with a data coordinating center where we're supporting research to really dive into understanding the causes and the consequences of having ME/CFS. Research is also provided in a congressionally directed program called the Peer-Reviewed Medical Research Program in the Department of Defense, as well as by several of the patient advocacy groups, including Solve ME/CFS Initiative and the Open Medicine Foundation. And all of these funding sources will fund investigators from outside of the United States. For the National Institutes of Health, it primarily needs to be research that is unique and could not be carried out in the United States, but we do fund foreign research. The other funding sources do support research outside of the United States. And research on long COVID in the United States is primarily supported by the NIH and the Center for Disease Control. And reports and publications from citizen scientists have been critically important, especially early in the phases of long COVID, to describe the symptoms and the course of long COVID. And in the United States, the patient advocates were actually responsible for advocating to Congress for a $1.15 billion appropriation to the National Institutes of Health for research on long COVID, which has led to a program that's called Recover, Researching COVID to Enhance Recovery. And in this program, the goal is to rapidly improve our understanding of an ability to predict, treat, and prevent past or long COVID. And so the key scientific aims are to understand the clinical spectrum, define the risk factors, incidence, prevalence, and distinct subtypes, to study the pathogenesis over time and possible relation to other organ dysfunction and disorders, and to identify interventions to treat and prevent long COVID. So there are many different phases of and study components, primarily looking across. First of all, right now, they're in the sort of the second bubble here, the Recover enrolling cohorts, where they're enrolling 40,000 participants who are going to be studied and followed closely. There are 60 million plus individuals whose medical records are being reviewed through the EHR and health systems studies. There are currently calls for funding, grant applications to support pathobiology studies. There are tissue pathology studies that are being done on autopsy samples. So these are not necessarily people who died from long COVID, but people who died while they had long COVID. And then we're working toward Recover clinical trials. And the hope really from all of this is that these studies, again, will definitely shed light on ME/CFS and will lead to a better understanding of ME/CFS as well as long COVID and accelerate the research that's happening on ME/CFS. So these cohorts are being recruited across the United States. You can see that there's many, and these are being recruited in adults, women who are pregnant, pediatric cohorts, and as I said, there are 5 centers that are doing studies on autopsies. So there's both an acute infectious cohort, so these are individuals that have COVID move and then transition into post-acute sequelae or the long COVID, and those who have been ill longer than 4 weeks with long COVID, including pregnant women. And one of the critically important areas here is also studying the phenomenon of MISC that's happening in children who have had COVID and transition into this very severe, often very severe immune response from having COVID. So for more information about the research on Recover, on long COVID, you can go to this website. It's recovercovid.org. And all of the information and information about long COVID is on this website, as well as information about the studies, funding announcements, and eventually clinical trials that will be underway for long COVID. So with that, I will thank you, and I'm happy to discuss anything in addition to what I've presented or to answer questions in the discussion. So thank you for the invitation to be with you today.
Thank you, Vicky, so much.